Thank you very much, Professor Kim. Thank you. Professor Liu, do you have anything to discuss, or shall we move on to the next case introduction?
We can move on to the next section directly. And before showing the ablation operation, another young doctor will introduce the patient. Okay. Would you like to introduce the patient?
Oh, yeah. Good evening, everyone. I'm Dr. Zhang. Now I'm going to introduce the second case with low-risk papillary thyroid microcarcinoma. Ms. Zhu is a 34-year-old woman with a thyroid nodule for 7 years. Then she followed up with thyroid ultrasound regularly. In July 12, 2021, the thyroid ultrasound revealed a solitary hypoechoic nodule in the left thyroid lobe, with the size was 0.36 by 0.28 centimeter, and the nodule was classified as thyroid 4A. Then in February 24, 2022, the thyroid ultrasound revealed a solitary hypoechoic nodule of the left thyroid lobe, with the size was 0.53 by 0.43 centimeter, and the nodule was classified as thyroid 4B. The nodular volume significantly increased in the last 7 months. So the fine needle aspiration cytology was performed, being consistent with papillary thyroid carcinoma, and the molecular test showed a BRAF mutation. After admission, the further tests confirmed a normal thyroid function, and the laryngoscopy suggested a normal vocal cord function. The patient didn't complain any discomfort. From this picture, you can see 0.53 by 0.43 centimeter hypoechoic thyroid nodule in the left lip with irregular margin. The nodule was classified as thyroid 4B. The enhanced CT of neck showed a 0.4 by 0.4 centimeter and no abnormal appearing lymph nodes. Now, I believe you can't wait to learn about the thyroid ablation. So let's start it.
Yes.
Thank you.
Okay, let's start it. First of all, this is a young and to middle-aged female, and the cytology confirmed papillary thyroid carcinoma, and the carcinoma is very small and without metastatic lymph node in the CT scan. Therefore, we discussed with the patient, there's a lot of choice for her, including active surveillance, so immediate surgery, and some ablation. And the patient know the benefits and the risks of each options, and she decided to receive some ablation. You can see that this nodule is located in the superior location of the thyroid lobe, which is very close to trachea and esophagus. Therefore, in the treatment with some ablation, the hydrodissection is very essential to protect the trachea, esophagus, and the recurrent laryngeal nerve. First of all, let's start with 隔离着。In the treatment of papillary thyroid carcinoma with some ablation, I think the aim of the treatment is to completely ablate the tumor. Therefore, we have to do a lot of work to exclude any metastatic lymph node in the neck and some other suspicious thyroid node in the gland. Otherwise, the patient may have a higher risk of recurrence. Okay, first of all, let's inject the needle in the space between thyroid and trachea. Okay, you can see. Okay, the thyroid was separated by normal saline from the trachea. Okay. From this picture, you can see the thyroid gland was successfully separated from the trachea, and I think this is very essential for a complete ablation of thyroid microcarcinoma. Okay, and then we will then we inject some normal saline to protect the artery from the thyroid gland. And this and then we insert the microwave ablation antenna under ultrasound guidance, and we okay, I think the needle is very close to the tumor. Okay, this is very safe, and I think it's in the center of the tumor. And then we start the ablation. A fixed ablation is required during the treatment, during some ablation of thyroid microcarcinoma, because we are afraid of any needle seeding of the tumor cells. Therefore, we commonly perform a multiple dimensional fixations ablation. And the ablated area is totally covered the tumor foci. My assistant infused normal saline continuously during the whole procedure to maintain a hydrodissection. And this is very important to protect the trachea and the esophagus and the laryngeal nerve. And it can help us to completely finish the ablation. okay, the whole ablation time is nearly 1 minute, and I think the ablation is enough for such a small nodule. And then we calculated the needle track to avoid any tumor cell seeding. Okay. Okay, it's finished.
That is very fast. Okay, so I think we've completed 2 cases within like 30 to 35 minutes.
It's very fast, right?
Very fast.
He's skillful. Because every week he perform a lot of patients, about every week about 3 to 4 times. This time 3 to 4 patients.
Oh, great.
Right. We usually perform only 3 to 4 patients every month, but it's 4 times the cases we do. So.
Because so many patients in China, you know.
Yeah.
Most of the patients are PTMC, low-risk PTMC. We don't ablate benign nodule very frequently.
Do you also treat in case of multiple papillary?
No, never.
micro-PTC?
No, never.
Never. Oh.
We don't
Only
have
single-
experience. Do you do that?
Oh.
Do you ablate follicular thyrocarcinoma?
No.
No, we don't do
We
it
do
either.
not. Yeah. We are now performing a prospective study to see the efficacy and safety of active surveillance of papillary micro PTMC. And also we have some prospective study in radiology department to see efficacy of the radiofrequency ablation for PTMC. But yeah, it just started the clinical study.
In Korea or multi-center?
Clinical.
We usually perform the treatment. Most of our patients are benign nodules, and only I think we have about 9 PTCs because normally, for example, this I think in China or in Korea, do you perform FNA with for small nodules? And we normally perform surveillance. So, but I think it's very interesting to perform the thermal ablation. Yeah.
But in China, we perform fine needle aspiration and cytology for almost every patient when the nodule is less than 1 centimeter. If the patient agrees to that, we do that.
So we have many questions in the comment section. So if you don't mind, I want to read the questions to you and we can start the discussion. Yeah.
So Professor Xu will come here and I will let him sit here, okay? Wait a moment.
Okay, cool.